Hello, my name is Christine. I have been working in the health field for many years and specialize in chronic pain management. I want to start by saying how genuinely sorry I am that you are dealing with an ongoing source of pain. Having been in a similar situation, I know how frustrating and helpless it can be sometimes. My goal is that you will walk away from my course with more tools to help with your condition. This program is packed full of knowledge and activities that I have found effective with various clients over the years. The more open you are to learning and the more you complete the directed assignments, the greater impact the course will have on you. First off, I want to explain what not to expect. This is not a magic cure. I cannot guarantee that your pain will go away or that you will be as good as new by the time you are finished with the program. I'm sorry, it just doesn't work that way. What I can guarantee is that you will have a better understanding of how pain works, learn physical and mental reasons for your pain, how to adjust ineffective thought patterns, develop a better understanding of pain levels, and learn how to modify and adapt to decrease your pain perception and increase your function. Now let's get started. While many times you may feel like you are the only one with chronic pain, you are far from it. In the United States, approximately 100 million adults struggle with this major public health problem, costing an estimated $560 to $635 billion every year. Worldwide, 1 in 5 individuals has chronic pain. That's 20% of the population making it through the day in pain. Some people hide it better than others, but it just goes to show that you never know what someone else is really going through. You may have even fallen victim to the common, "But you don't look like you're in pain," or even, "Come on, it can't really be that bad." Annoying as it can be, sometimes we just have to put on a face to make it through the day. Pain encompasses changes in both the body and mind. I am sure that there are many ways your own illness has affected your life. When most people think of pain, they think of biological pain. This is typically something that medical doctors can diagnose and other people can see, such as a broken bone or a burn. Sally can offer us a perfect example of biological pain. She sprained her right ankle, and now the muscles and tissues are damaged. There are 5 other variations of pain that are often forgotten about and found in conjunction with biological pain. Oftentimes, individuals will experience several variations of pain with a single injury or illness. Psychological. Emotional suffering that can cause anxiety, depression, or other symptoms. For example, an injury can prevent you from running with friends until the area has healed. This can cause you to feel sad and restless. Cognitive. Individuals will often look up their symptoms to find logic and meaning to it. Increases in pain and discomfort can also make simple tasks, like remembering when you fed the cat, a challenge. Behavioral. While sometimes seen as a mixture of biological and psychological, it is the way a person will start to move and act. A lower extremity injury may cause you to limp and start avoiding driving because it hurts. Spiritually. A major accident can have you questioning God, bargaining for help, or remind you of your own mortality. Culturally. Different cultures have different ideas of what pain means. This can further be influenced by the kind of role that the individual plays. How often have you heard, "Boys don't cry"? Mothers with chronic pain often find it hard to take care of their injury and their children without feeling guilty that society is judging them. At what point does your pain become considered chronic pain? Acute pain is your typical pain. It comes on suddenly as a result of a specific event, such as cuts, surgery, or broken bones. This form of pain stops when the underlying cause is resolved and does not last longer than 6 months. General chronic pain lasts greater than 6 months with no acute cause identified. This can mean that no exact cause was ever identified or the injury should have been resolved. There are several types of chronic pain categories. Chronic recurrent pain is resistant to treatment with periods of no pain. Chronic intractable benign pain is consistent and does not respond to treatment. And finally, chronic progressive pain is malignant and increases with the progression of the underlying condition. Your doctor may or may not have given you a formal diagnosis, but now you should be able to further identify what kind of pain you have. What's one of the first things you are asked when you go to the doctor? Your pain level. This is one of the most basic and simplest ways for practitioners to have a baseline for your visit. It is also one of the worst methods because it is so subjective. Very few people have ever truly experienced a 9 out of 10 pain level. However, it is regularly reported by the chronic pain population. There are many different pain scales out there, from just numbers to faces and seemingly random pictures, making it difficult for both clients and staff to truly understand the amount of pain that you are in and how much progress you are making. You know the drill. On a scale of 1 to 10, what would you currently rate your pain? Got it? This is one of the most detailed pain scales that I have found. Take a moment to compare your pain level to the chart and see how much they align. Maybe it's different, maybe it's not. Pause the video if you need more time. Regardless of the system you choose to use, it is vital that you define what each pain level means to you. Often individuals can identify pain that is very high or very low, but have a hard time deciding what it means to be somewhere in the middle. While a pain scale is helpful for medical tracking, describing the type of pain is just as, if not more, important. Someone who says they have numbness running down their leg or uncontrollable bowel movements might have a nerve problem in the spine. This is quite different from someone who just complains of generalized leg pain. Here are a few types of pain. Many injuries will have several words that describe how the pain feels. Just like your pain level, they can change daily or based on activity. Get comfortable identifying your own types of pain. Are you ready for a secret? From a clinical standpoint, I will honestly tell you something that the medical profession may not want you to know. Consistently reporting a pain level of 9 out of 10 and stating that nothing makes a difference will usually get you nowhere. Medical professionals and insurance carriers only have so much time and money to spend on each client. I want to make this crystal clear. I am not telling you to lie. Please be honest how you are feeling. Some people will say they are rating based on how they felt prior to injury, that they've never given birth or had a major injury, so it is high, or that they just guessed on what they were supposed to say. It is extremely important to clarify your pain level and type, and report what has and has not helped you. This will help guide your treatment and possibly identify the underlying cause of your chronic pain. You may have some physical or unconscious psychological component that was previously missed. Working with your doctor will help this. Here's a common question with chronic pain individuals. Is the client suspected of malingering? Malingering basically means faking it for a secondary gain. I have seen this firsthand many times, but I do try to give each individual the benefit of the doubt. Most of the time it is very obvious, or the client will flat out tell me that being injured allows them certain privileges. One woman I met literally had her husband feeding her, despite the ability to do so herself. Another man got to stay home and play video games while his wife went to work. Just because these people exist does not mean that everyone is that way. Some people don't even realize that they are doing it. The most important takeaway here is this. Your pain is your pain, and nobody but you knows what it is like. Two people may have the exact same broken bone, but they do not have the same body, motivation, resources, or environment. Every single factor in your life can influence the way you respond to injury. Today, you should be able to better define your pain based on level and type. One of your assignments is to use the included pain tracker, at least until your next session. Fill it in as much and as often as you can to help identify pain triggers and trends. At least try to complete it morning, noon, and night. There are many different charts and apps available online if you choose to use one of them. The important part is to be consistent, to become more aware of your body, and how to describe it to others.